Good afternoon. The governor has asked me to kick off today's Team Kentucky update, and we are starting the way that we have been lately, and that is with more good news on investments and jobs across Kentucky. Kentucky's economy has been on fire, and that momentum continued this week with several important announcements for Kentucky families all across the Commonwealth. We have a governor who knows how to build an economy of the future and a lieutenant governor who knows how to build the workforce of the future. And we do that by investing in our children's education. So when you add that with the innovation and dedication of the companies we are going to highlight today, you have the perfect combination for a growing Kentucky. I'm excited as several of these announcements mean better paying careers for people across Kentucky and in rural Kentucky. Our administration is committed to providing all Kentuckians, regardless of where you live, with the opportunity for a career that provides stability and prosperity for your family. So first up, we have the Firestone Industrial Products. Back in May, we announced a tremendous job creation project in Whitley County when Firestone Industrial Products shared plans to expand and create 250 jobs. On Monday, Governor Beshear joined company officials and local leaders to see that project take a major step forward. Firestone broke ground on a 68,000 square foot expansion of its Williamsburg facility. This more than $50 million investment will allow Firestone to better serve the rapidly growing electric vehicle market with its production of automotive air springs and air suspensions for a range of automotive customers. It also furthers the goal of this administration to create quality job opportunities for Kentuckians across the state with average hourly wages of $29, including benefits. Firestone began operation in Williamsburg in 1989 and has been an important employer in the region for more than 30 years. The company is helping lead the charge for our state's growing automotive industry, producing 4 million parts annually and already employing over 500 Kentuckians. It is great to see that growth, especially in southeastern Kentucky. Thank you to the leaders of Firestone and Bridgestone for your commitment in our state. We all look forward to the completion of this expansion by the end of next year. Next up, we have Pennington, Stave, and Cooperage. On Tuesday, Governor Beshear was in Edmonton in South Central Kentucky for an exciting announcement that shows the enduring strength of Kentucky's spirits industry, especially our signature bourbon industry. Pennington, Stave, and Cooperage, LLC is investing $3.5 million in new equipment that will create 60 jobs with above-average wages for the Metcalfe County region. This project was only possible through a whole lot of cooperation. The governor was there to award more than $600,000 from the Appalachian Regional Commission, along with more than $1 million from the Community Development Block Grant Program, and more than $90,000 in local funding is being used to finish out a spec building that will house this operation. Pennington will produce staves and barrels that largely will serve Kentucky's iconic bourbon industry. Bourbon, as many of us know, gets much of its flavor, color, and character from aging to perfection in charred oak barrels. Bourbon is an $8.6 billion signature industry in Kentucky and provides more than 20,000 jobs in Kentucky with an annual payroll topping $1 billion. Right now, there are more than 9 million barrels aging in the Commonwealth. That is 2 barrels per every Kentuckian. Soon, many of those barrels will be made by Pennington workers in Metcalfe County. So congratulations to Chad Pennington and Pennington Cooperage on this major investment and to the families who will benefit from this outstanding project in Metcalfe County. Next, we have R.A. Jones. As we build an economy that works for all Kentuckians, we have emphasized the need for businesses to create quality, well-paying jobs, and this next announcement does just that. R.A. Jones in Kenton County is growing its presence in northern Kentucky with a $2 million investment that will create 20 high-wage jobs for Kentuckians. At an average hourly wage of $43, this company is creating opportunities that include mechanical and electrical engineering, machining, fabrication, assembly, and service technician positions. The project supports R.A. Jones' production of packaging equipment as demand for its products has surged in response to the pandemic. An increased reliance on sanitary and disinfectant products and growing demand for packaged meats and other food and beverage items is creating an even greater need for this packaging equipment. R.A. Jones has operated in northern Kentucky for more than 100 years and serves a variety of industries, including food and beverage, home and personal care, automotive, electronics, chemicals, and healthcare. This is the kind of company that highlights the diversity of our state's manufacturing base. In total, Kentucky is home to around 4,500 manufacturing facilities, which employ approximately 260,000 Kentuckians statewide. The importance of manufacturing in Kentucky is clear when you consider that 13% of our state's workforce is in manufacturing compared to 8.5% at the national level. So we're proud of our manufacturing presence in the Commonwealth, and we are thrilled to see R.A. Jones build a footprint with this investment. Next up, we also have WellCare of Kentucky. I want to recognize an expansion project creating 18 jobs in Eastern Kentucky and building on our state's growing healthcare presence. WellCare of Kentucky is a Medicaid and Medicare services provider that currently employs 22 people at its call center in Hazard. The company is moving ahead with an expansion that will push its total employment in Perry County to 40 people. This is a great project for Hazard as the location edged out facilities in larger cities like Nashville, San Antonio, and Tempe, Arizona for its expansion. This is a reflection of the excellent workforce that we have in Eastern Kentucky, and company leaders pointed to a high retention rate as the major factor in choosing this location for their project. Company leaders also noted that once fully staffed, the call center will contribute $1.6 million in wages annually for the Hazard community. WellCare is a company with a strong vision for the future, and this expansion contributes to the company's larger nationwide growth plans. In the Commonwealth, we have more than 200 healthcare-related facilities, which employ over 37,000 Kentuckians that include everything from headquarters operations to pharmaceutical makers to medical device manufacturers. WellCare's expansion adds to that thriving industry, and I want to thank its leadership for furthering its commitment here in Kentucky. Last but not least, we have another outstanding week for our state's automotive industry, as another great company just broke ground on an expansion in South Central Kentucky. Just this morning, Bilstein Cold Rolled Steel moved forward with plans for a $17.8 million expansion of its Bowling Green campus. The company is constructing an 8,500 square foot facility to join its existing 105 square foot operation in Kentucky Trans Park. This investment will include the purchase of new equipment and upgrades to existing equipment, as Bilstein aims to serve a larger portion of the North American automotive market with its specialized steel products. This expansion will allow Bilstein to exceed the job creation targets it made back in 2015 when it announced plans to locate its first North America facility in Bowling Green, Kentucky. Currently, the company employs 86 people. With the completion of this expansion, that number is expected to grow to 120 Kentuckians. Our automotive industry has been one of Kentucky's greatest strengths for a very long time. We have more than 525 automotive suppliers and 4 automotive assembly plants operating in our state, employing over 100,000 Kentuckians. Since the start of 2020, our automotive sector has seen nearly 40 new locations or expansion projects, which will create over 1,500 full-time jobs for Kentuckians and inject $380 million into the state for new investment. So I want to thank Bilstein's leaders for keeping that momentum going, and I look forward to see what's coming from them next. That was a lot, but those are just the highlights of this week's economic news. We have seen more good news on the horizon as Kentucky's economy surges ahead. It has been an exciting and hopeful time for our state, and we have to keep that going. So with some advice on how to keep that going, I'm going to turn it over to Governor Beshear to talk a little bit more about what's going on in Kentucky right now. Governor?
I think the Lieutenant Governor said it. We have an economy that is on fire. We have an opportunity at more prosperity, more potential than ever before in my lifetime. We have that Kentucky that we've always dreamed of, that potential at our fingertips. But if we are truly going to realize that opportunity, we must win our war against COVID. And I didn't just say, move ahead. I said, win that war. If we are going to defeat and not just delay COVID-19, there is one and only one answer, and that is vaccinations. So each decision that we as a state make has to gauge the impact on getting the unvaccinated to take that next shot. We've got to be absolutely certain when we take steps, will it help in that next big push to get people vaccinated? And we know very clearly what it's going to take for that next big step. It's two things. Number one, we need local leadership. Leaders in community that people know and know their families. And number two, we need the private sector stepping up, setting an example that we have already seen works. You look at an example of local leadership. That Metcalfe County announcement that we were at, the guy who emceed it, if we can bring him up, his name is Matt South. Matt is the Industrial Board Authority Chair for Edmonton and Metcalfe County. Matt is a registered Republican, certainly knew many of the other officials that were there, Republican officials, much better than he knew me. I seriously doubt if Matt voted for me the last time around, but I'll hold out a little bit of hope that maybe that could have been the case. But Matt decided to end what was an incredible jobs announcement, echoing something that I'd said about vaccinations, but doing it in his own words. He said, I have two grandkids, one 7-year-old and one 2-year-old, and they can't take this vaccine that's been provided for us, and that scares me. So please get the vaccine for my grandkids and for yours. These are Matt's friends. These are folks that it might be a hard conversation to have. These are folks that it might change their opinion on him locally. But he stepped up and he made a statement on the biggest of stages in his community in a very personal way to push these vaccines. We need more leadership like this. And that's leadership like JCPS and Fayette County Public Schools, the Lexington Diocese, thank you to Bishop Stowe, Rowan County Public Schools, all of those doing masking. Groups in the private sector like Tyson and Churchill Downs. And moving to the private sector, we have now seen that there are individuals that will not get vaccinated if government officials are saying, please get vaccinated. But if their employers ultimately require it or set certain other requirements if you don't get it. I've talked about the NFL a lot because it's a good example. The NFL recently showed us that to business, COVID isn't red or blue, it's green. It's lost productivity, it's lost profitability. And what we saw is that until the NFL created some mandates and had some penalties if you weren't willing, a whole lot of multi-million-dollar athletes that we're now learning about hadn't gotten vaccinated. But every day we're starting to see another story about someone saying that I wasn't going to do it, and maybe they're even begrudgingly now doing it, but they are getting vaccinated. I think the fact is clear that with private sector leadership, we see more individuals getting vaccinated that we otherwise could not reach as state government. So today, we have a number of private sector health leaders with us. Dr. Stack is going to talk about them and going to introduce them. But I think today is a pivotal day in our battle against COVID-19, where you see a unified front from these health leaders that's going to help get a lot more people vaccinated. And I think you see them taking just about the very first step, one that will be replicated across the Commonwealth thanks to their courage. And these are the folks that have been in the trenches, that have been trying to keep people alive, that can tell you personally the stories about those that are getting intubated that ask if they can get the vaccine then. Today, you will see a huge unified front that is going to move Kentucky forward. And remember, they're leading, which is what we need. And as I have to decide the steps that I need to take when I need to take them, I need to make sure that we don't just have folks following. We have our local officials and our private sector leaders truly leading. You're going to see an incredible example of that today. This is going to be one of the days we remember about how we won this fight, especially against the Delta variant. Now, Dr. Stack.
Thank you, Governor, and good afternoon, everyone. I'm going to be light on the data today and talk more about the leadership that we have in the state and that we benefit so much from. The Delta variant is serious. This is the short encapsulated version of this. You need to take precautions. The measures that we did last year and that we still have to rely on now work. If you cover your mouth and your nose with a mask, if you make more space, usually 6 feet or more between yourself and others, wash your hands, cover your cough, get tested if you think you're exposed or infected, and stay home if you're sick. If you do those things, those alone would prevent COVID from spreading. But they're hard to do, and they interrupt our social activities, they interrupt our lives, and they're not really compatible over the long haul with the way we want to live. Vaccines are the exit strategy. Vaccines are the way we bolster our immune systems to protect ourselves and others from this disease. Vaccines are the ways we don't have to rely on masks and space and rigid adherence to hygiene to keep ourselves protected and safe from this terrible disease. The Delta variant has unfortunately improved itself, and we've talked about this. The original Wuhan version was bad enough. The Alpha variant, which we associated with the United Kingdom, spread about 50% more effectively than the original one. The Delta variant spreads about twice more efficiently, or 200% better, than the Alpha variant. It also has much higher viral loads, and early anecdotal evidence is it may also hurt younger people, and yes, perhaps even kids, more than the earlier versions of the virus. We treat this virus casually and cavalierly at our own peril. We can't afford to do that. Getting vaccinated and getting all of us vaccinated is essential to getting away from the mess we find ourselves in for more than a year and a half now. So if we could show my first slide, please, James. This is the one data slide for today. You've heard this in the media reports. Florida used an example that was very compelling. But this time is different. Because Delta spread so quickly, the rate of rise, the magnitude of the acceleration of the pandemic, this wave is far more quick and substantial than the earlier versions. In Florida, they said in the media reports over the last couple of days, in the last big surge they had, it took about 2 months to go from 2,000 people in the hospital to 10,000. They accomplished that 2,000 to 10,000 feet in 1 month this time. This is just the ICU chart, or the graph from our data pack, and this shows the entire journey. I put red lines on there that are just my visual matching. It's not a statistical program. It's Steve Stack doing his best to fit the line to it. But if you look, the rate of climb is much steeper on the one we're in right now to the far right than the one further to the left. We have seen, and some of the people who speak after me may share some examples, we've seen a rapid escalation in people in the hospital, but we have also seen disproportionately that virtually all the people in the intensive care units, and sadly the people who are dying, are by far and away overwhelmingly unvaccinated persons. So folks, we've got to get everyone vaccinated. So if I can show the next slide, please, James. We've talked about healthcare being an incredibly important area where we're going to have to rely on it to determine when we have to take additional measures, if there are other measures to be taken. And I've already said vaccination is the principal measure we have to take. So now I'm going to share what I think are some true moments of leadership in our state and entities and people for whom we should be very grateful. So the Kentucky Hospital Association, the Kentucky Medical Association, and the Kentucky Nurses Association have all come together to make a joint statement in support of their belief and their expectation that every healthcare worker should be vaccinated to protect themselves and to protect the vulnerable patients who rely on them for their care. I just want to applaud these three associations and their leadership. These decisions are not easy. No one makes these decisions to recommend actions like this lightly, and I congratulate them for the leaders that they have and their willingness to make hard decisions and show that leadership through this action. If I could have the next slide, James. Here on this slide, we have the long-term care community. So Leading Age Kentucky, the Kentucky Association of Healthcare Facilities and Kentucky Center for Assisted Living, the Kentucky Society for Post-Acute and Long-Term Care Medicine, and the Kentucky chapter of the American College of Healthcare Administrators. These entities have also come together to state that it is their belief as well that all healthcare workers in their care settings should be vaccinated, and they are in support of the requirement that they do so, again, to protect their staff, to protect the people who reside in their settings and who rely upon their staff to stay safe and well. Again, I applaud these institutions, these associations for taking this step. I know none of these decisions are made lightly. They're made with careful consideration of a whole lot of different elements, but I think it is true leadership, and Kentucky is so grateful to have these associations and their leaders. And now if I could move to the final slide, James. We have a number of guests here today, and I think they'll use their own words to tell their reasons for joining along in this. But the healthcare systems shown on this slide through their logos have all committed to the statement shown above. They have all committed to requiring their entire healthcare workforce to begin a complete vaccination series no later than September 15th, 2021. I didn't calculate with precision, but the healthcare systems shown on this slide probably represent more than 70 or more than 75% of all the hospital beds in the entire state of Kentucky. They don't do this lightly. They did it with great care and thought, and they do this in order to keep their associates, their employees, and their patients, most importantly, safe. I applaud them for their leadership, and I have said all along this journey, it has been an incredible privilege to work with leaders across all of society, throughout all of the Commonwealth, as we've come together to put other concerns and other disagreements aside in order to all pull together to be part of Team Kentucky to keep us all protected and safe. And I'm just so proud to be part of this group and to have been a part of their leadership and their decision that they had reached to do this, and that we could be here today to share that. So we've invited them to be able to come up and share a few words with us. And the first person is Ms. Holly Harris Phillips, who is the President and CEO of Appalachian Regional Healthcare.
Thank you, Governor Beshear and Dr. Stack. We at ARH sincerely appreciate your leadership during this fight in this pandemic. The numbers you saw today that Dr. Stack presented on the slide are very representative of what we see across the Appalachian Regional Healthcare System. Our beds and our ICU beds are full of unvaccinated individuals. We at ARH are proud to be here today with our fellow CEOs from around the state at other health systems. Most of the time we're competing for business with one another. However, today we stand here together committed to vaccinating our workforce. We strongly believe that this vaccine is our hope and our tool to protect our patients, our staff, and our families. So thank you for having us.
Thank you very much. And now we have Jared Coleman, the CEO of Baptist Health.
Thank you. As Steve and Governor Beshear have already said, this is a war. It's a war we have to win battle by battle, and we're at a battle point right now. And we feel at Baptist Health that we've seen a significant increase in the rise of COVID for the last 30 days that warranted us to make decisive action. With our peers here today in the healthcare community, we stand together to vaccinate our entire community. That's 25,000 caregivers across the Commonwealth that we will be vaccinating in the next couple of months. We do that not lightly. We do that as a serious part of our mission to really not only reduce the spread, but reduce the spell of illness for all the people that we serve and our caregivers. And with that, I say thank you.
Thank you. And then we have now Mr. Tony Houston, who's the Market Chief Executive Officer for CHI St. Joseph Health.
Thank you, Dr. Stack, Governor, all those here. Like you've heard from others, we don't take this decision lightly to ask all of those who come each day to care for our neighbors and our family members to take the vaccine. We undertook a lot of prayer and discernment in order to get to this place, but we are happy at CHI St. Joseph Health to join these other healthcare leaders to ask each of our coworkers and our medical staffs to take the vaccine. We pledge to make our communities healthier. This is the best way we know now, especially with the Delta variant raging, to help keep ourselves healthier, our families healthier, and ultimately our communities healthier. At CHI St. Joseph Health, we were founded by the Sisters of Charity of Nazareth in Bardstown, Kentucky in 1877 to bring forward that commitment to do better, to do good. And we stand here today to do likewise. Thank you.
Thank you. Now we have Dr. Melinda Joyce, the Executive Director of the Research Foundation at MedCenter Health in Bowling Green.
Thank you, Dr. Stack, Governor. I am very pleased to be here today on behalf of Connie Smith and the leadership. This decision was not made easily or lightly, but it is the right decision, and it is the decision for the greater good. One of my very dear friends was Dr. Rebecca Shadowin. Dr. Shadowin was an infectious disease physician who unfortunately just about a year ago lost her life to COVID. We had many conversations about what a vaccine would mean and how it can completely change this pandemic. Therefore, I am so pleased to be part of this unified approach today. And I think the decision that is made is one of the ways that we can honor the memory of Dr. Shadowin, as well as all of those others that lost their lives to COVID. Thank you.
Thank you. And now we have Mr. Donovan Blackburn, the President and Chief Executive Officer of Pikeville Medical Center.
Thank you, Governor, for the invitation to come today. Thank you, Dr. Stack, for your leadership in this unprecedented time. I'm just, in essence, going to echo the same comments and the sentiments that have already been expressed. I'm honored today to be here among my colleagues in this monumental step forward in defeating this virus. Knowing what this has done and the toll that it's taken on so many communities is just amazing. When we look at the surge that we saw on the deck earlier, we're no different. Just a month ago, I had 3 patients, one in the ICU. As of this morning, I now have 43 patients in the hospital. Over a third of them, are actually in the ICU fighting for their life. They're on ECMO, they're on vents. And if you look at the age group, we're seeing much younger patients. Those in the ICU, I have folks in their 20s fighting for their life today on vents. I have patients in their teens now coming into the hospital. This step is necessary if we're going to win the fight. And again, I appreciate the leadership and the invitation to be part of this prestigious group today. Thank you.
Thank you. And now we have Mr. Don Lloyd, the President and Chief Executive Officer of St. Clair Healthcare.
Thank you, Governor, Dr. Stack, we truly are honored at St. Clair Healthcare to join our colleagues throughout the state. I implore those of you that are not vaccinated to please, please, do what is right. Do what is right not only for the patients and the employees of our health systems, but do what is right for our doctors and our nurses who have been on the front line now for almost 2 years. Our doctors and our nurses took a pledge to do no harm, and they're put in harm's way every day by this vicious, vicious virus. So I ask you, please, this isn't a political statement. This is what is right for the lives of the good people of the Commonwealth. But do it for no other reason but for those men and women that are on the front lines that risk their lives every day for the betterment and for the cure of this condition. Thank you.
Thank you. And now we have Dr. Mark Newman, the EVP of Health Affairs for UK Healthcare.
Again, let me add my thanks to the Governor and to Dr. Stack for continuing to facilitate and to push us forward in the right direction. For many of us in medicine, we remember the day that the vaccine became available. It was a huge relief, even amongst the surge that we were having at that time. And I think I even described it as the beginning of the end of COVID. You have to be careful what you say, Governor. I do still believe that. Then and now, COVID, again, our best weapon is the vaccine if we want to see an end to this pandemic. However, for us to see that end, we have to work together. And I want to thank all my collaborators because this is, again, the way we continue to go forward is working together. Our hospitals and clinicians have worked together throughout COVID. We've worked to meet the demands that have come, and I couldn't be more proud of our frontline healthcare workers and all they've done and how we've responded. And I do think that today, this next step, again, is just that. It's us coming together again to work and to identify the idea that the vaccine offers our greatest protection for our people and for our patients. That's what we're about, our people and our patients, and it offers our greatest protection. And hopefully it reinforces to everyone that the vaccine is safe and effective, and we hope encourages everyone in the Commonwealth to think about how they can move forward. All of us gathered here today from all of our different constituencies are there when you need us. We're there when you're sick. What we'd rather be right now is there to help you prevent that severe illness. That is what we want to be able to do. And the best way that you can partner with us is to get vaccinated so that you can protect yourself, your family, and those around you and show that we can keep the Commonwealth moving forward as we've seen today. Thank you.
Now, Dr. Jason Smith, the Chief Medical Officer of U of L Health.
Well, I'll go ahead and echo all the allies, friends, and colleagues that have stood up here today and said, thank you to Dr. Stack and thank you for the Governor for the support you've offered all the healthcare community around this state and around this entire region, to be honest with you, during this pandemic. I'm proud to be up here. U of L Health has been on this journey just a little bit longer, but as I said, it's good to have allies and friends. And when you look around this state from the beginning of this pandemic, the hospital systems and healthcare systems you see represented here today have worked together to make sure that our state was prepared, that we were protecting each other and protecting our healthcare workers, but also working to make sure that when the vaccine got out, and I remember the first vaccine too, that we were there for our communities. This is another opportunity for us to stand up with each other and stand up in front of our communities and demonstrate that this vaccine is safe and effective, You can forget all of the crazy information and stories you hear. Simply look around to your allies, your friends, the people you live with, and the people you live next to, and think about how can I protect them from this virus? And the one simple answer to that question is, I can get a vaccine. I can get a vaccine and keep someone else from getting sick, keep me from getting sick, and keep my family from getting sick. And so we stand up here to say thank you for all of those who've gotten the vaccine. We stand up here to urge everyone to get a vaccine, and mostly we stand up here in solidarity with all the rest of our healthcare organizations to say we believe in this vaccine enough that we are going to make sure that our healthcare teammates are going to be protected from this virus. Thank you very much.
And now Mr. Gary Blank, the EVP and Chief Operating Officer of St. Elizabeth Healthcare.
Thank you, Dr. Stack, and thank you, Governor, particularly for your leadership in giving us the resources we've needed to fight this battle on the front lines for the last year and a half or more now. Our first priority at St. Elizabeth, and I know all the health systems, is the safety of our patients, our visitors, and our employees, as well as our community. And vaccines are the best way for us to ensure that at this time. Coming to this decision, obviously, tough times require tough decisions, and this is one of those that has an impact on our over 10,000 associates and team members, the majority of which have been vaccinated. They're all worn out and tired from a grueling almost 2 years now of COVID and the death and despair that's come from it in the healthcare setting. We too, over the last 30 days, have seen a spike. We've had a nice lull for about 2 or 3 months, and exponentially the numbers have grown. We've been primarily unvaccinated individuals in our hospital and 100% unvaccinated individuals in our intensive care units. And I cannot commend this group enough for stepping forward at this time and making this tough decision and really putting our best foot forward for our community. So thank you very much again for all you're doing.
Thank you. And James, I think we have a video from Norton.
But this Delta variant has created a dire circumstance for us, and we need to be proactive for our community. We all chose a career in healthcare because we were willing to serve others. This is a time when we can serve our patients, our families, our coworkers, and our entire community by protecting ourselves as much as possible, which in turn protects others. This vaccine is the way we can do exactly that.
So as I wrap up my remarks and hand things back over to the governor, I just want to remind folks, about nearly 1.6 billion humans have been vaccinated with these vaccines worldwide, using nearly 4 billion doses of vaccine. We know for a fact this virus is dangerous and becoming more dangerous the longer it has the opportunity to spread rampantly. We also know that these vaccines are protective and that they are safe, and that when you look at the relative risks of the disease and the vaccines, there is no debate, there is no uncertainty. Being vaccinated is hands down the far better route for all of us. And as we see this new version of the virus potentially endanger younger people, those who thought it wasn't going to ever affect you, I don't think you can take that comfort. And if you read history books and look back to 1918, there were whole military bases where 10% or more of some of the youngest and healthiest people in American society were wiped out by the influenza strain at that time. So I urge everyone to get vaccinated. I want to thank again all of these leaders. I don't know exactly what other states have done in this route, but I will just say I'm fairly confident that no other state has managed to pull together the largest leading health systems across its entire state and professional associations and trade associations pretty much across the full swath of acute and long-term health care, and at one point in time all declare that this needs to be done and to put action behind their words. So I thank you all, and I encourage all Kentuckians who know these folks and the people who work at these institutions to thank them as well. We are much better as Team Kentucky because we pulled together through it. Governor, thank you very much, and I appreciate it.
Folks, what we've just seen is courage. And we as Team Kentucky so appreciate that courage. And on behalf of Team Kentucky, please go back and tell all of your amazing employees how incredible they are and that we are deeply, deeply grateful for taking care of our loved ones, for sometimes holding the hand of our loved ones as they pass away, for holding the phone so we can communicate with them, and for making sure that they do not feel alone, and by and large for getting them out and back home. We are eternally grateful, and we will absolutely never forget them. Your nurses, your doctors, those that check people in, those that provide the janitorial services, every single one of them walks into danger, and every single one of them is a special, amazing hero who we needed during this time more than maybe about any other. So in Kentucky, you've seen us take steps, and we will continue to take the steps that are required to protect our people. But we are going to do it the way that we have all along, one step after another, as necessary as we go. We did that each time we addressed a surge. We did that each time coming out of a surge. And while we may do things sometimes gradually, we typically do them faster than most places in the country. For instance, we were the first state in the country to go back to requiring state employees to wear masks while at work. We were the first state in the country to embrace the CDC's recommendation and say that all school systems should mandate the wearing of masks regardless of vaccine status in schools. We were the second state in the country to recommend masking indoors regardless of vaccination status. And we were the fifth state in the country to increase our testing in state-run health centers if individuals were not vaccinated. We will continue to take steps to get more of our state workers vaccinated. And today, it comes in the form of an additional incentive to those state workers that have gotten vaccinated or will get vaccinated. So in many ways, like the CEOs that you have just seen, I'm one myself. I'm the CEO of a $12 billion, 20-plus thousand employee operation. Your state government does critical, even life-saving work, everything from some of that health care work in our veteran centers to the inspection of bridges to the prevention of child abuse to the safety of all of our people. And thus, we have to be committed to continuing to push for these vaccines so that our workforce is not in jeopardy and the people that work for me are ultimately protected. We've been encouraging our state employees to get their shot of hope each and every day. And with the example that's been set here today, we're going to have to go back and think even more about our healthcare workers, because I think what I'm seeing is what may be the standard of care now moving forward and what's expected. In January, when the vaccine started to become more readily available, we allowed all executive branch employees up to 2 hours of scheduled work time to take each of the COVID-19 vaccines without prior supervisory approval. We were able to give time off for recuperation for those vaccines. But today, we're going to go even further. Today, I'm announcing that we are awarding active, permanent, full-time, even part-time executive branch employees with 1 additional day of annual leave, that's vacation, upon the submission of proof of receiving a COVID-19 vaccination. That's if they've already been vaccinated or they're willing to get vaccinated. We're going to give them an extra day off work, which I think just about everybody will take. That is not the time that they already get to go get vaccinated. That's not the time for recuperation. This is an incentive so that you can spend more time with your family doing what you want to do for doing the right thing. This applies to everyone that is under my control in the executive branch, and any constitutional office that would like to participate in this initiative can submit a request to the Personnel Cabinet. We would love to have you also out there pushing vaccinations. Additional information for the Personnel Cabinet is forthcoming, but again, we are pleased to offer another incentive. If you are a state worker, we care about you. We care about your families. We care about your unvaccinated kids that you could bring this home to. We care about the work that you do that is critically important. You might sometimes not feel fully appreciated. We're here to say we need you. and we need you to be healthy. We've lost far too many people in this fight, and I don't want to lose any more people at all, much less those that work for the Commonwealth of Kentucky. And as we look at where we are today in battling this virus, it's more important than ever that people get vaccinated. So today we will report over 2,000 cases again for the second straight day. We don't have the exact number yet. Our positivity rate will again increase. I think we're 35, 36, 37 days in a row. We think it'll be 10.27%. And today we will announce 4 new deaths. We can see that cases are rapidly rising, and that should tell everyone that what we are dealing with is aggressive. It is also now hitting more younger people than ever before. We'll look at the breakdown of age like we do on right now Monday and Thursday, but nationwide this statistic came out yesterday that COVID-19 cases among children and teenagers are up 84% in 1 week. And I want to say it a lot, but I'm a dad of a 12 and an 11-year-old that I love more than life itself, and this ought to be setting off alarm bells in everybody. Your kids are not a proxy for a political battle. Your kids are not your property. They are your solemn obligation to do the very best for each and every day, and we need to make sure that parents are making good decisions for their kids, to get vaccinated, to mask up. Anybody out there can argue with their neighbors, they can argue as much as they want on Facebook, but just do the right thing for your kids because they are more and more of who is getting sick. So that's nationwide. Let me show you in Kentucky. We created a quick chart to show you the difference in number of children that have been infected with COVID-19 from June and then to July. So in June, children 18 and under, 1,197. In July, 4,165. Almost 4 times more cases in kids in July than in June. And I think all the healthcare executives here would say that pace is even increasing every day, not just every week. But how about children under 12? These are who cannot get vaccinated. I'd like to think that we all owe a duty to who can't be vaccinated. I hear sometimes somebody say, well, I'm not putting on a mask because I've been vaccinated. Well, what about everybody out there that can't get vaccinated? Because you can still spread it if you get a breakthrough case. And what about that child of God, under 12, that you could put in harm's way? So in June, 534 kids, 11 and under. In July, 2,092. And that continues to increase. Let's look at the vaccinated versus unvaccinated. We put this chart up each time. What this says is, again, the vast majority of the patients that all these systems are seeing, and you know what, working their best, regardless of the decisions that those people made, working their best to get them well and to get them home. This is still so much more prevalent in unvaccinated individuals than vaccinated. We've continued to show you this chart, and on the right, July has always grown so steeply in the unvaccinated when actually it is now more effective, or you have a bigger protection almost 5 times in July than you even did back in March. Yes, you're more likely as a vaccinated individual with this Delta variant to maybe have a breakthrough, but you are certainly so much better protected. But let's put up the other chart, the vaccination status of Kentucky COVID-19 cases. All right, this is updated since Monday. 92.3% of all cases unvaccinated Kentuckians. 91.4% of all hospitalizations unvaccinated Kentuckians. 88.7% of all deaths during that period unvaccinated Kentuckians. Now, I will say, I do think as we move forward that the breakthrough rate will grow. I think a lot of it's asymptomatic, and we have to know that there are more individuals than just that have been vaccinated, that get the virus and thus can spread it. That's why wearing a mask indoors now is so important. And I said that yesterday in the video. Every single Kentuckian, I don't care where you live or what county you're in, when you are out of the house and you are indoors, you now need to be wearing a mask. We don't have to make it any tougher than that. You need to get vaccinated. And when you're out of your home, indoors, you need to be wearing a mask. That's where we are, and that's what it will take. Let's give a little bit of good news. Between yesterday and today, we're reporting 8,667 new vaccinations. That's up. We were having a lot of days where we were reporting 1,200, 1,300. We are seeing an increase. That brings us to 2.337 million, or 2,337,312, at least first vaccinations. Let's look at the breakdown by age. And the first one is the best one, because it's the first time in a little bit that we have increased a full percentage point on the 18 years and older. We're now up to 64%. The next four are the same. We still have our 2 in the green, though certainly 67. We need to be more fighting the Delta variant. 40 to 49 stayed where it is. 30 to 39 stayed where it is. We've gone up 1 point in 18 to 29-year-olds. I'm happy to increase a percentage point, but when you look at it only being 38%, there's a huge amount of room there. And you've heard from the folks that run these hospitals how young the people are that are in their ICUs. They're in this area. So please, if you haven't gotten vaccinated, either because you had COVID, listen, the reinfection rate is going up and up and up. You need to get vaccinated. Or because you think you're young and invulnerable. We had a 21-year-old die in Davis County that we reported yesterday. He or she died on the 2nd of August from COVID. 21. That's basically the start of adulthood. So much life in front of that individual, and now taken from their community and from us. Get vaccinated because it's the right thing to do. Get vaccinated because this Delta variant is as scary as anything we've seen, or get vaccinated to win $1 million. We have one more drawing. Kelly Alexander, our Chief of Staff for the Department of Public Health, got to hand our last winner the actual check today, minus taxes, because government always takes out taxes first. But got to hand it over. It's real. One more person's going to win, and 5 more kids are going to win a free higher education. We've had 268,550 individuals in Kentucky vaccinated since we launched it. Right now, this is the last chance at $1 million, best odds that you will ever have. I very much support the Kentucky State Lottery. Your odds here are really, really good. Play both. Get that shot for whatever reason that matters to you. Just get it. All right, with that, we'll move into questions, and then afterwards we'll have some Team Kentucky All-Stars, and then one more piece for us to close on. We'll go first on the folks that are here, then I've got some written questions. We're trying to spread out more with what we have, and so we're going to take some more written questions, and we're going to try to get virtual again. So Carolina, I think you're up first.
Businesses in the private sector that are non-health related when it comes to their employees being vaccinated and also being vaccinated?
I think that private enterprise, I think that other companies should follow the lead that we're seeing here today. They should follow the lead of Tyson or of Disney, of Walmart, and of others, of doing everything they can, including what was announced here today, requirements to get people vaccinated. We're going to support each and every one of them that do. But again, my message is that for a company faced with the Delta variant, in many ways, COVID isn't red or blue, it's green. If you don't have healthy employees, if they get COVID, they don't show up for work. If you don't have healthy kids of your employees and they end up going virtual, your employees don't show up for work. And if it's hard to find workers right now, and we think that we're breaking through that, just imagine when the workforce you already have is debilitated because of COVID. This is absolutely necessary leadership, courage like this, not just to fully and finally win this thing, but to continue our economic resurgence, an economy on fire, potential like I've never seen. We got to grasp. Lawrence.
Do you believe will trigger new mandates from you, like a mask mandate, things like that?
Any mandate is still on the table, absolutely. And we are looking at all of the data each and every day. One piece that is critically important is our hospital capacity. We got to make sure that there is a bed for everyone, not just those that get COVID, but those that have a heart attack or a stroke or other things. Someone's refusal to get a vaccine that spreads the virus, that fills up beds, can not only kill somebody who gets COVID, but somebody who has another treatable issue that can't get in because of a hospital that is too full. So we're going to continue to work with our healthcare partners, and we're not going to be afraid to do the right thing. But remember, we have always talked about the importance of clear communication before any of those steps and of timing. You know, you want to take the best step at the right time with the most people who will be willing to go along with it, who see and understand where you are and the necessity of it. So again, we've always taken steps, and we will continue to do so as needed. Tom Latek.
Thank you, Governor. I have two for you. One, state employees are working a hybrid schedule now. As part of the guidance under Healthy at Work, telework is really encouraged. So are you going to be sending them back into the telework world? And secondly, do you see a potential for a super spreader event at Fancy Farm this weekend?
So first, on state employees, we're doing what we think that all employers should do, and that's talk about vaccines plus masks equal defeating this virus. Yes, we're allowing some more telework. We have been the whole time. But with vaccinations plus our employees wearing masks, we think they're safe to show up to work. So we're going to continue to provide in-person services where we need, because you have both of those tools. Now, we're going to need to take some steps to provide for any state employee that has a breakthrough case, because if they've done everything that we've asked and they still get COVID, we want to make sure we're there for them if they have to quarantine and when they're out. That's probably the next personnel move that we need to make. All right, next we've got a representative from WLKY, but I don't have a name. Anybody? Nope. Okay, Melissa Patrick.
We know what percentage of healthcare workers have been vaccinated or still need to be vaccinated, and what will happen to employees who refuse to be vaccinated? Is there a testing schedule set up in that regard as well?
So for the state? I think each hospital system is setting up their own policies, and I'm sure if you send out that question to the groups, they'll respond with them. They do need flexibility, which I can understand, and there may be certainly there are alternatives for those with certain health issues that don't allow for it. Certainly for us, our recommendation there would be significant increased testing, but each hospital system, these are health experts, will ultimately have their own. As far as vaccinations statewide of healthcare workers, I think it varies by region and also by classification, depending. I think we see a high level of vaccination among our doctors and our nurses. I think we see a high rate of vaccination amongst hospital workers. We see a much lower rate among long-term care workers. And we see some of the same thing within our state. I will say we see the power of leadership, even within our own state. Our Department of Veterans Affairs, we talked about yesterday, that run those long-term care centers, each and every one of them is over 60, most of them 70 and 80% vaccinated with their staff. And I think that's great leadership from Keith Jackson, who's the head there. I got asked a question about Fancy Farm. Could it become a super spreader event? Well, we have seen that the Milwaukee Bucks celebration, people packed in tightly, jumping up and down and shouting, appears that it may be a super spreader event. What I would really suggest is move everything outside, have people wear masks if there's going to be a big crowd, spread them out, don't do the screaming. I'm not sure there's going to be anybody to scream at, but just protect yourself, and most importantly, go get vaccinated. Go get vaccinated. I don't want anybody harmed at Fancy Farm, and there's the opportunity for that to happen, especially these sit-down dinners. that get packed or packed in. That in an area of the state that doesn't have a high vaccine rate and maybe has a larger group of unvaccinated individuals than you'd otherwise, it's dangerous. And I don't want anybody to get hurt. I keep thinking about, even on some of the toughest days for me, that individual who hung me in effigy, I do not want him to get COVID. I do not want him to be harmed. I want him to be able to spend his time with his family and his friends, and Lord, I hope he and others have gotten vaccinated. Stu Johnson, I thought I saw Stu. There you are.
Back in January, I believe
So the question, as I understood it, was what's the likelihood of reaching like the prior peak and how high might it go along those lines? I don't think we know. I really don't think we can predict that. I think what we had in the beginning, we relied on models that the governor has shared, which were terrifying because you had a completely vulnerable population, none of which were exposed, and so you could make assumptions and try to project. We don't have that now. We have proportion of the population, maybe up to 1 in 4, who've been infected already, but who are subject to reinfection. And there's going to be some news on that here in the next few days about information the CDC will publish on that, about you still have to get vaccinated because your own immune response doesn't hold up long enough. But we've got about 1 in 4 who've been infected, then we've got about 46% who are fully vaccinated in Kentucky. But that what remains is still a large enough population to really spike this as we're seeing. But how sick they get, whether they fill the ICUs completely, whether they overrun hospitals and stuff, is yet to be determined. Is it possible we're going to reach those peaks? Absolutely, it's possible. Is it possible we'll exceed those peaks in terms of cases? Absolutely, that's possible. And at the rate we're going, it won't take that long. It'll happen in August. So that's absolutely possible. But the question is, how much does it fill up the hospitals? Do the hospitals have capacity? Do they have enough workforce to take care of the people who need care? And more importantly, I just hope people, as they see that, will go out and get vaccinated, because if they get vaccinated, we wouldn't have this, and those hospitals would have plenty of capacity. And remember, if you're having a heart attack or a stroke or any other medical problem, go to the hospital. Don't stay home like last year. Go to the hospital and get care. But we need to make sure they have enough capacity to care for everybody, which is why we all have a vested interest in this, no matter what we think about COVID itself. I hope I've addressed your question.
Debbie Yetter.
Have you looked at the state's public universities in terms of mandatory vaccination? I believe all of them were still strongly encouraging it at school levels.
At this point, I've not spoken to our universities about whether or not they might mandate vaccinations. I'm sure that they are looking at potential legality and other analysis for it. I am very proud of Northern Kentucky University for coming out and going ahead and put out that as school starts, everybody's going to be masked indoors, regardless of vaccination status. That's certainly leading there. Phil Pendleton.
Governor, there are some hospitals that are not included on that list. Not every hospital or healthcare organization in Kentucky. What would you say to those, especially some of the larger hospitals that serve multiple communities that are not doing this?
So we haven't been able to reach out to every single hospital yet. So just because they're not on the list doesn't mean that they're not in or won't be in. These are the biggest hospital systems, and it is our hope that others will follow their lead. And yes, there are a couple that aren't on there, but look who is. The vast majority of employees, people employed by a hospital, are represented here today in a united front as big as any one that I have seen across any state. The overall Hospital Association also joining in, the long-term care organizations as well, the overarching organizations. So I think you see what may be the single greatest unified front for this strong of a step in the healthcare sector, at least that I've seen across the United States. Joe Ragusa. Well, the filling up of our hospital beds and ICUs and ventilators is absolutely something that concerns me. We are watching closely and will play a big role in any additional steps that we take. We have not allowed our hospital systems to be overrun. We cannot allow that to happen, and I'm going to be willing to do what it takes to prevent that from happening. Next, we've got a number of written questions. We've seen hospitals take steps to require all employees and volunteers to have their COVID-19 vaccination. Will we reinstate a mask mandate through an executive order to slow the spread? I think we've answered that today. That is not off the table. We will be watching especially the hospitalization numbers. We will not let what is happening in Florida and other places to happen here. Now, we are not at the same place that they are right now, nor that Louisiana is right now. But we are going to be willing to take the steps to prevent that if they are necessary. Let's see. Why is the cabinet not mandating vaccine for healthcare workers at state-run healthcare facilities? So first of all, what I proved in the very beginning, the only one that came to me, was an increase in testing unless you were vaccinated. Yes, we put out a press release that said something different. That was not the decision that was made, but listen, that was in our press release. I get it. That's ultimately on us. I'm going to say that we are going to be relooking at the policy that we put out last week because of what we've seen here today. I think we've seen best practices, and we're going to have to look at whether or not we are able to do that within the state. To applaud their courage and not to strongly look at it ourselves wouldn't be right, and so we're absolutely going to do that. The governor has said he believes that school districts will do the right thing when it comes to mask requirements and follow his recommendation, but many school districts are not. Well, school hasn't started back for most of them. And we have at least 3 school districts that have had to postpone the start of the year because so many kids already have COVID. What I'm trying to make happen is that same local leadership that we saw in Metcalfe County, because people know their superintendent in these communities. And if they'll look at you as a parent, if you're upset about this and say, I know, and I know it could affect my job, but it's really important if you want your kid to be in school, and it's really important to the kids who haven't been able to get vaccinated, it sends a much more powerful message than us just doing it from here in Frankfort. Now, we're going to watch the numbers. And again, making that requirement is not off the table, not by any means. But the power of both private sector and local leadership, of that person that you know and whose kids you know, is so critical. And to beat a Delta variant, to finally win this for good, I'm willing to do what it takes, but we really need others on the ground putting the right thing ahead of their jobs, showing people how important that this truly is. All right, I know this has been a pretty heavy day and a pretty heavy press conference, but I think we have seen an amazing step that's going to help us win this battle. So we have 2 things to end up. One, our Team Kentucky All-Stars, and after the Team Kentucky All-Stars, for the first time, we're going to have a least valuable player that'll leave us on a little levity. On July 30th, there was a severe storm in Nicholas County that caused historic flooding. When I say historic, I mean it. There is only a 0.1% chance of what happened there, how serious it was actually happening. There was more rainfall in 110 minutes in this county than there's typically in the entire month of July. Tragically, 1 resident died in the flood. Approximately 80 homes and 30 businesses were destroyed, and I saw them pulled off their foundation with a giant red X spray painted on them and a condemned sticker put on it. I can't tell you how that must feel. Nicholas County officials estimated over $1.5 million in infrastructure damage. It is staggering. But what I saw is a community that is not backing down, that is banded together, that is working together, and that is committed to rebuilding. They are today's Team Kentucky All-Stars. I want to thank the first responders, healthcare workers, emergency management personnel, and all the counties around them that are pitching in to help. Another county brought some ambulances. The city of St. Matthews brought an extra fire truck because there weren't any operating ones in the community. On Tuesday, I issued a state of emergency to unlock more resources for assistance and sent a letter to President Biden as well as the Federal Emergency Management Agency. Lieutenant Governor Coleman and I went to the community, and we saw people that were hurting, tried to answer questions, and are now providing more resources. Yesterday, we announced a multi-agency recovery center that will open this week to assist these individuals because they have 8, 9, 10 different needs that ultimately come from different places and want them to get the help in just one place. It's in the Nicholas County Elementary School Gymnasium, 133 School Drive in Carlisle. It'll be open tomorrow, Friday, August 6th, from 10 a.m. to 6 p.m., and on Saturday from 10 a.m. to 4 p.m. When we are in crisis, we come together in Kentucky, and we definitely saw that in Nicholas County. Now to leave you with hopefully a little laugh for you, but certainly wasn't for me. Our least valuable player this week is Winnie Beshear. Because last night, at about 8:30, Winnie decided she wanted to go out one extra time barking at me, at which time she attacked a skunk. Getting skunked, the worst that I have ever seen a dog, and filling up the Kentucky governor's mansion with a smell that I hope it has never, ever seen before. So being governor is supposed to be glamorous, but when you spend several hours in a shower trying to get that smell off your dog, and that these are about the only clothes that you can wear today, that makes Winnie Beshear a very, very bad dog. Now, I know that, again, we've talked about a lot of heavy things today, but remember these moments in your life, even when they are tough, can hopefully bring a little bit of levity. She can't even look at me. Thank you all very much.